Hi all, this is Dr. Jay Mawhinney again. I just wanted to talk about venomous snake bites. We're passing the heavy spring time when there's tons of bites, but these envenomations can happen anywhere from April all the way through September and October, and until the snakes start to slow down again when it cools off. There's, it doesn't matter whether it's a coral snake or one of the vipers, the many vipers, the water moccasins, the copperheads, or the many rattlesnakes. They're very dangerous, and especially certain species of the coral snake, they literally keep biting and envenomating, and depending on how long they keep biting, it determines how much venom was put into the body. The problem is there's really only one antidote, and that's the antivenoms. There is a coral snake antivenom that's available for those in Texas and Florida and the places where there are coral snakes. And there's 2 or 3 different antivenoms for the vipers, and without antivenom, it can be really bad. I mean, there's neurotoxins in certain species of coral snakes, but also the Mojave and even the Pacific rattler is starting to show up with these neurotoxins, which actually can cause total paralysis over a couple days, and including paralysis of the respiratory muscles. The antivenoms that are available, there's really only one that reverses it, and it's really not cleared in the United States, but supportive care and at least treating the other parts of it, the anticoagulant parts where they're bleeding, and the horrible muscular damage that happens from the myotoxins, which is what they call it, that can just totally destroy large amounts of tissue surrounding the bite. And the circulatory things where they go into shock and severe dehydration, and even something called DIC, where you're going to get secondary clot formations, kidney failure, liver failure, all sorts of dang things. There's a misconception that this rattlesnake vaccine is going to protect these pets against envenomation and the toxic effects. It buys some time, maybe. Most of the specialists don't even think it does that, but there's some empirical evidence that it buys a couple hours before you can get these guys on fluids and eventually the antivenin to try to reverse the effects without very intensive fluid therapy to keep the blood pressure up and circulation up, and while we're getting ahead of the tremendous blood fibrin and other clotting factor things that are just totally destroyed. This is not something that can be done outpatient. They really need to get ahead of things, and sometimes it's 2 or 3 days before you're totally out of the woods. Get the dog or cat to the veterinarian immediately. And whether it's an emergency clinic, I don't care if it takes 2-3 hours to get to somewhere. Don't wait till morning. It can be too late. And sometimes the doctor's been using plasma instead of antivenin, and actually plasma makes things worse. So you got to be real careful. Try to read up on it. Protect your animal. Try to stay away from areas where rattlesnakes are, and if not, just be very careful about what you're doing. And if sadly enough it happens, get them to an emergency clinic. Have a good day. Love your pet. They ask for nothing but food and love. Take care.